Hello and welcome everyone. Thank you all for being here today. I'm Ahmed Seleem. I'm the Vice President for Nexthink. I've been leading the region here for the last 15 years, and we've been working with healthcare industries to enhance and optimize their digital employee experience, improve their well-being, and work on improving the productivity as well. Glad to be here with you today. And now moving on to the more important people on stage here, Mr. Junaid Khan. Junaid is the CEO of PureCS. PureCS is the Pure Health company, one of the companies in the group of Pure Health. Mr. Junaid is one of the pioneers in the industry, an entrepreneur well known for building operations from ground up. Welcome on stage, Junaid.
Thank you.
Thank you. And to top off the audience that we have today and people on stage, I would like to welcome Mr. Neeraj Gupta. Neeraj is the CEO of Policybazaar UAE. Neeraj brought his international experience in technology and business analysis in the insurance business. With his innovative mindset, he has been leading and growing Policybazaar since he started in UAE. Welcome on stage, Neeraj.
Thanks, Ahmed.
Thank you. Great. Well, to start off today, my guests are invited today to discuss the critical role of data analytics in improving community health outcomes. So what we'll be doing today is we'll explore how large-scale data banks can be effectively utilized to enhance health outcomes, prevent disease, and measure program impact. I'm going to start with asking Mr. Junaid a couple of questions. First question, Junaid, is how do you think large-scale data banks can contribute to addressing health disparities and improve access to care?
Thank you, Ahmed. Thank you for the introduction, and glad to be here. Good afternoon. Good afternoon. Okay. I know this is the last session before lunch, so I just want to keep it there. Let's talk data because the question is around on the data stuff. So do you have any idea how much data do we as a human race or all the systems produce in a day? It's about 400 petabytes of data that we generate worldwide in a single day. So just to give you an example, because these are all peta, giga, and all those bytes, if 1 gigabyte is the size of the Earth, then 1 petabyte is the size of the sun. And we are generating about 400 petabytes of that data every day. 90% of the data that exists today was generated in the last 2 years. And the 30% of that data is healthcare data. The healthcare data is growing at about 36, 38% a year, which is like 6% more than the manufacturing, 10% more than the financial industry, 11, 12% more than the median. An average hospital generates about 50 petabytes of data, which is like double the size of the Library of Congress. But here comes the interesting part. 97% of the healthcare data that is generated is not used. So all that we are doing is around that 3% of the data. 97% is wasted. It's lying somewhere, just not basically being utilized. So the question is that why is that, right? So I'll give you a simile in order to understand that particular piece. We have all heard the term data is the new oil, right? But how many of us has actually gone to a data oil or to an oil field to fill our tank? Basically, the data needs to be extracted out. It has to be refined. It has to be transported. It has to be brought into a form that can be usable by somebody to utilize it. Similar is the stage with all the data that is basically being generated across the healthcare. It has to be extracted, refined, made of some use for it to be of some value. So I think that's where we are at that particular stage. So now to see exactly what are the barriers in order to understand that particular piece, we'll put it into 3 categories. One particular part is technology. The second is the data security, consent, regulations, and everything. And the third part is the interoperability. These are the 3 elements which basically define how we are going to use it. So the technology, more or less, is sorted because, not sorted, but in the sense that it is available. All the things that you see in the AI, with the AI O1 now basically out, which is more like a reasoning platform, than a pure chat GPT kind of a prompt basis. You have got all the different tools in order to understand big data, etc., all of those particular things. So that's technology is there. It's the application of that particular technology. The second piece is the data security. A healthcare record is about 35 to 40 times more expensive on the dark web. The value of a healthcare data is much 35 to 40% more than a typical financial industry record. So now combining those particular two together in terms of the value of that particular data, then it comes the regulator, then it comes to all the things that are basically required around that particular part. So the third piece is the interoperability. Now you go to anywhere in the world, you basically use your phone and it works.
Yeah.
Why? Because you have got the interoperability between the various different countries on the network. But you go somewhere, they will know nothing about your healthcare information.
Absolutely.
Right?
Absolutely.
So I think that's the third piece which basically comes in as part of these things. So once combine all of these together, that's where it's primarily going. So the data availability is there. How you bring these three things together, the security piece and everything, that will allow you in order to be of value and the patients can actually utilize that one.
Brilliant, brilliant, brilliant. Thank you, Junaid. I think that that clarifies a lot of questions I've heard from the previous panel as well. And thanks for clarifying this and connecting all the dots together. I think it's important to look at the three components together so that the whole system works. Right? Now, just for people to try to picture this and to really have a real insight on this, can you provide us just with a couple of examples of how these data-driven insights have led to improvements in the access of the care itself?
Okay. So I think one is of course, the Reality platform, which we have all heard on this summit as well, which we as PureCS run and operate in collaboration with the Ministry of Health. There was a case in which in one of our hospitals, somebody was brought in unconscious. We had no information as to what that particular person record is or the healthcare information is. But with Reality, anywhere in the UAE, you can actually go and see that particular person's record. We were able to find out that that particular person has allergic to a certain thing which the doctors were about to administer.
Okay.
So that could have been a life-threatening scenario situation as well. So that's purely based on the data and the availability through interoperability that a doctor was basically said, that don't mean you need to give that particular thing and that creates. The second part is what we have done with respect to Pura. So Pura, I think you've heard during the sessions, whereby we have taken the data which is all coming from the healthcare, plus all the wearables and everything that you are generating out of that to make sense to provide the end user or the person to manage more your life care, more than your sick care. So your health piece, a particular thing, in order not to fall in that scenario. And also at the fingertips, you have got all your information about yourself. You can even, in places where you go, like the example I gave, if you go outside, you can actually show them that particular information. Just a couple of examples whereby data is not only saving lives, but is also something which is available.
Oh, that helps a lot, Junaid. I think it's very important also to look at the practical side of it, because it's very important to look at the data, gather all the data and all the stuff, but the practical implementation of all of these technologies is the thing that really makes a difference. I've heard a couple of times today people saying that AI has always been the buzzword, data has always been the biggest, I'd say, motivation to do all these actions. But if we cannot use it properly to the level that it impacts the daily life of citizens and people, it wouldn't make any sense eventually, right? Thank you, Junaid. Thanks a lot for these insights. And now I'll move to Mr. Neeraj to get the other view of the whole ecosystem, which basically is looking with Junaid from the healthcare provider angle, and at the same time looking with Mr. Neeraj from the healthcare plan provider perspective as well, to have a 360 view on this. Now, Neeraj, how can data-driven insights be used to develop more effective health insurance plans and services?
Thanks, Ahmed, and thanks everyone for having me here. It's a pleasure to be here. So if you look at insurance, right? Insurance, if you look at historically, it was always built on historic data. So all the actuaries and underwriters would go into what has happened so far, and basis that you'll start to build these plans, right? But now with all the data coming in, and thanks Junaid for giving those numbers on how much data is being generated, and if you look at now what is happening is going towards the predictive side. And what that helps all the industry is to probably build products which are not going to be used as such today, but will be required in the future. The one of the major things that everybody would have seen and experienced with your healthcare provider also is post-COVID or during COVID, a lot of preventive health came about. Earlier, if you would look at it, a health insurance provider would typically not interact with you. Either you're hospitalized or using the policy, he would come, or at the time of renewal when he wants a wallet share. Right. But now today, health insurance companies have started going into do preventive health. And the reason is because that helps them in understanding what the consumer behavior or what the experience is going to look like in the future on their healthcare. Because from their perspective, they need to be able to predict how the risk is going to come about in the future, right? So what we are seeing is all these data is now being used by healthcare providers, at least on the preventive health. And they're consuming this data to predict on the types of services that will be required in terms of the plans, the customization to each consumer. That has started to happen. And what we also see is, if you look at the population globally, right, the biggest challenge which is happening is you're getting a longevity of life. So people are going to live longer. But the challenge there is, are they going to be living healthier? That's one of the things, right? And to address that, what this data science and everything is helping the insurers is predict this. And as a result, if you look at it, insurance companies are getting more involved in terms of what does the person do in the day and how does he consume different things? How does he eat? Is he fit or not? And if you look at these sciences, earlier if you look at one of the major impact of lifestyle was on the healthcare was sleep. Now what you're seeing is it is moving to, okay, sleep is important, but do you exercise regularly is becoming important, right? So this data is getting into the insurance space also and the services and basis that they're building it on.
Great, great. No, I love the fact that you used the predictability point of view. This is whatever we get also inside and from a data when we start to work on it reactive and when we start to work on providing all those plans and all that are based on what happened, it makes a huge difference when you're proactive. Try to look into this and try to do the predictive analysis to tailor the plans and to tailor everything according to the insightful data that came from the healthcare systems. And I think this actually leads us to the second question, which is what, I'm going to challenge you a little bit here because usually we would always like to end on a positive note, but I'm going to give you some challenging point to discuss, Neeraj. What are the challenges and the opportunities in using data to drive the inclusive healthcare policies?
So one of the things which Junaid also touched about is permission, right? Consumer data. How do you use that? How much do you use that, right? I believe if you read a lot in terms of different surveys has been done with consumers and globally, right? And they're okay as far as the data is used from an overall perspective to help the community, but they're not okay if it starts to get monetized. But the challenge is where do you draw that line? If I'm going to use this data to build a better product, eventually I'm going to monetize it, right? So, so that's
why it's a challenging question, yeah?
That's a challenge, right? So, which everybody struggles with. Obviously, you have your regulatory bodies to obviously guide you on that, but there's a very thin line. And it's very difficult to understand when you've crossed that. And your intention also might not be to cross that line. But it just happens, right? Having said that, that is one piece. The other piece on, at least I'll tell you from a health insurance perspective. See, health insurance basically is a community insurance, right? If you just go through the essence of it, that all people living, sitting in this room, we can't afford healthcare costs on our own. So let's build a community. We'll give health plans to everybody. So somebody consumes, everybody funds this, right? It's sort of that thing. Now, when you start using a lot of data, what starts to happen is Junaid and I will be underwritten very differently. Junaid exercises, has a fit lifestyle. He'll be charged a lesser premium. Neeraj, not so much great lifestyle, so I'll be charged higher. Now, with the advancement in technology, if you look at it, now you're able to also predict, okay, the possibility of having certain critical illness is a lot higher. So am I going to outprice Neeraj from the entire piece? And am I then going to start building insurance product only for the fit class? Whereas the insurance, probably the need for it is a lot more to me, right?
Yeah.
So these are some of the ethical challenges which do exist, but at the same time, obviously, data helps with the opportunity in terms of, for example, if my healthcare provider with all the data is able to predict that I am gonna face XYZ things, and through my devices, smartphone, and it keeps on pinging me, okay, do this exercise, okay, push in for 1,000 steps. I believe it also helps, right?
Yeah.
But yeah,
Yeah.
it's a whole
No,
big
great.
challenge.
No, great. And I fully agree. It's that gray area between should we actually consider this as something that we should stop here, or should we extend a little bit? Need to find the right balance to make these decisions, not to make it, that it's, and we're stopping, we're blocking. So everything needs governance, everything needs control, needs a little bit of, I would say bigger picture.
Yeah.
But at the end, it still needs to be tailored for every single citizen to get really the benefits of policy, right? Now, forward looking a little bit, just looking into the future. I'll start with the same order again. I'll ask Junaid, what are the future trends in the use of large-scale data banks in healthcare, future looking?
Yeah, so I'll be quick on that. I think future, as we have heard throughout the last two days, is all around the AI piece. But we primarily are saying is that artificial intelligence should not be for artificial solutions. They need to have the real value, and for that there's a complete path to it, right? And path, you have talked about data being there in order to do this. One thing is that it's not that data should go to AI, AI should come to data. And that is what exactly what the trend is. I think there was a study about a year and a half ago, McKinsey and Harvard, saying that in the US alone, in the 3 years, with the proper utilization of AI, it's about a $350 billion of efficiency save, right? So considering that particular thing, efficiencies in order to create this. The second part in the future is that today you go and you don't challenge an X-ray machine or a lab result to say whether it is working properly or not, right? It is primarily table stakes, mainstream, right?
Yeah.
So the AI, in order to get into that particular part whereby people, first the physicians and everybody in the healthcare's confidence, and then the people's confidence getting into that particular part. So it will come. The problem is that the AI and the overall technology space versus the complexity of the healthcare ecosystem, they need to pace up in order to be much more productive and effective solutions coming out.
Got it. Makes sense. And Mr. Neeraj, what's your point to this as well?
I believe, as colleague mentioned, Junaid mentioned, AI is the buzzword, and some form or the other form of AI is going to be used extensively. From a healthcare perspective, obviously what Junaid mentioned, but from an insurance perspective, again, I believe preventive is becoming the big thing. And what they are focusing on is how do I ensure my consumer stays healthier, and the services that are provided are available at the point where it is needed, right? See, with data, what am I able to also do is focus on the see, if you want to build a service, right, you have 10 aspects to services which could be related to a disease or related to an area. But what data helps you with it in future is that entire planning. So it's available when you need it and whomsoever needs it, right? So I believe what we are seeing is that aspect from a future perspective. Preventive is going to become a mass scale. I believe we've talked about preventive. A lot of people have worked on it, but I've still not seen huge usage from a consumer perspective. But that's changing. And the other aspect is in terms of planning for the services, right? That is where a lot of AI is going to be used.
Yeah. I fully agree, Neeraj. And just to wrap up, I just want to thank you, first of all. It makes a huge difference when you see the story from different sides, because whenever we speak to a healthcare provider, we feel that the discussion is always into, we want to provide all of this, and then you go to the other side with the plan providers, and they see things differently. So that harmony between what Mr. Junaid said and Mr. Neeraj said makes the story complete. And I think here in UAE, we've been doing very well, thanks to the fantastic leadership here. Please join me to thank our panelists today here. Thank you, Junaid.
Thank you.
Thank you, Neeraj.
Thank you, Ahmed. Thanks, Junaid. Pleasure.